So Medicare Con. Medicare Con was a 2-day conference, a 3-day conference. We were only privy to 2 of the days because the 3rd day was just in person only. It was a conference that was hosted by Justin Brock, the Medicare guru, in Alabama. I'm not sure how many people they had, but I think it was well over 1,000 agents, went for the conference. So we streamed it for 2 days here. I think if you talk to anybody that watched it, they really did feel the conference was great. Some of you was sick and streamed it from home, and some of our sub-agencies so streamed it at their offices. I feel like we got a lot out of it. Curtis will tell you that he was super pumped up after the 2-day conference, and he feels like his mindset is just completely changed, and he's like in the right direction, to do what he's got to do. So one of the big things they said was to make a deadline with a consequence. You need to hold yourself accountable. You have to set goals, set activities to achieve those goals. You constantly need to revise that, and you have to repeat it over and over and over again, right? Ask yourself, what do you want? Okay, because that's really important. I mean, I could preach a bunch of different things to you guys, but my goals might be different than your goals. Maybe you only want to make a few $100. Maybe you only want to make $3,000 to $4,000 a month, and you want to only work 20 hours a week because you want to golf, or you want to spend time with family, or maybe you're writing a book, or you have another aspiration. Okay, and that's fine. That's okay. But we all have different goals, but in order to achieve those goals, right, you really need to know what it is you're trying to accomplish. So write it down, put it on paper, try to hold yourself accountable. In order to be successful, though, you need to develop a plan and keep your calendar full. I mean, that was one of the main takeaways, keeping the calendar full. And once you get busy, consistently busy, like a Danny, like a Maria, like a Ralph, okay? Curtis is probably going to get there soon. Claire will get there soon, okay? I already mentioned Danny. The next step, guys, is to hire help, is to hire an assistant. Because what happens with agents is we get busy with busy work, or we get distracted with busy work, right? We think we have a full day because we're writing out business cards, thank you cards, right? Or we're working on a 2,000-piece mailer. And I'm not saying those aren't activities that help you be successful, but in sales, you're going to be more successful the more people you're in front of. And if you're spending 3 or 4 hours of your day working on a mailer, that really isn't an activity that's going to make you money. You need to be in front of people constantly to make money. And then the next step, and it could be a combo step to that, is getting an LOA agent. What does that mean? Getting an agent under you. Now that person can be an assistant as well as an agent. I kind of suggest that's the way to go. There are different opinions on that. Some people say no, just keep the assistant, and then hire another agent. Now, some people might be saying, well, why do I need another agent? Well, again, for those of you looking to take your business to the next level, if you want to be making $200,000, $300,000, $400,000 a year or more as a sole producer just selling Medicare, that's going to be difficult to do. Okay. Because of the amount of customer service that gets involved when your book is over 1,000 people. Now, again, you might be content just making 100,000 or 150, and that's not your aspiration, and that's okay. But this was something that most of us were like, okay, this makes sense. This makes sense. Now, how are we keeping the calendar full? Things you guys already know you should be doing, right? Retail, professional referral sources, center of influence, events, leads, direct mail, and social media. Now, I know we had a marketing training recently, and I was saying, the thing with social media is that it's good in some ways. You have to find your niche, but part of the problem with it is that if you don't have financially the money to spend on ads, You can't compete with what's going on out there in the Medicare world. And one of the things we learned from some of those call centers, and when I say call centers, not the eHealths of the world, smaller call centers, right? These guys are spending $30,000 a day on Facebook ads. So you think little old me running a Facebook ad is going to be able to compete with that? No. So don't waste too much time and energy. Okay, it's okay having a little website, it's okay having a presence on social media, but if you're spending hours a day on social media, you're wasting your time. You're absolutely wasting your time. So you need knowledge, you need skill, you need drive, and you need confidence to succeed in this business. You need all four, guys. Because if you have the knowledge, you have the know-how, but you don't necessarily have skills to close, or you don't have the drive to keep going, right? Because there's going to be a lot of failing in this business. You're going to have a lot of people tell you no, but the more no's you go through, right, you're going to get to the yeses that much faster. Especially those of you doing like the business reply cards, or those of you calling the T65 leads from the T65 locator app, okay? That's hard, guys. That's not easy. These people are getting a ton of phone calls, and now you're one more of them, okay? But it's a numbers game. You have to make 9 to 12 contacts minimum before you're going to be able to schedule an appointment. You just have to keep being persistent. But on the knowledge side, okay, I got too many agents, I feel, with the questions that we're getting asked on a regular basis that aren't knowledgeable enough. And they're not knowledgeable enough because they're not making training a priority. You have to train constantly. And I think those of you that are less than 2 years in the business should be here in the office face-to-face training. I don't care if I'm 20 minutes away. I don't care if it's 30 minutes away. It makes a difference. Because the other thing that makes a difference is the conversations and the sidebars that you have with your fellow agents afterwards. Because you guys are out in the field, right? Or you're working from home. You're not really forced to converse with one another that often. Like unless you have a friend or something in the business. But I don't have it on the slide, but the other thing, you know, I mentioned when we were doing Medicare Con, and I don't know why I hadn't brought this up sooner, but because I did it when I was a field agent, is think about teaming up with another agent. Hold one another accountable, help each other with events, you know? I mean, Claire's probably got more things going on than she knows what to do with, right? And she doesn't want to walk away from anything completely because she knows there's opportunity there, but she's got a lot of, you know, activities. So why not team up with an agent? If you guys are doing seminars and you're having 20, 30, 40 people in attendance, really anything over 10 people in attendance, you need a wingman. Okay? You can't be greedy because at the end of the day, you're just going to lose sales because one person working a seminar can't efficiently work the group. You can't work the room efficiently. And sometimes you don't know how many people are going to show up. Back in the day, Deborah and I were seminar partners. We did every seminar together, whether she got the event, whether I got the event, whether it was an event that Humana gave us, we worked everything together and we just split the business 50-50. And we trusted each other, but we just split the leads up 50-50. And if more of her leads were panning out and she was going out to see a couple, she would say, hey, Stace, why don't you go with me on the appointment? I'll write the husband, your wife. Guys, working as a team works. You have to have the right partner, but it works and it can really help you out in the long run. Sometimes even with these health fairs and events, when you have hundreds of people at the event, you can't efficiently work that event on your own. So I want you guys really to consider that. And if you think you want to team up with somebody, but you don't know who to go to, then come to me or Ralph, and maybe we can help team you up with somebody. And if it doesn't work out, it doesn't work out. No one's going to have any hard feelings, but it might be nice having that accountability partner. And if you're relatively new and you're nervous about working events, maybe it's nice to have, again, that wingman to kind of help you, right? The more people you help, the more money you make. Those that have been with me for a while have heard me say over and over again that we are in the best business in the world, right? Why? Because we get to make a lot of money by helping a lot of people. So my main takeaway on Medicare Con was activity. Every successful person that got up on that stage, they did a lot of activity, period. Their days were full. It's very easy as an independent agent not to have full days. Another takeaway we had gotten from Medicare Con, and this one is kind of funny because Kevin and I got this information when we were out in Mississippi when we seen Justin Brock. He told us this is who he's using. Well, I took 10 pages of notes when I was in Mississippi. I couldn't find it for the life of me. And then they brought it up when we were on Medicare Con. So that was my other takeaway. But check it out, guys, because this is a direct mailer where you can go in, set up your own stuff, set up a QR code, maybe send people to a video. It's postcards, but it's more cost effective. You guys all know I love send out cards. For me, I probably won't stop using send out cards because I like to send gift cards and brownies and different things with it. This doesn't, I don't believe, allow you to send gifts. It's just cards, but you could do this more cost effective. You can even upload your own your handwriting and everything. So write that down, thanks.io. And maybe use it for your existing customers to send out your thank yous or your once a year reminders.
Could be a good AEP lead-in.
Yep, a good AEP lead-in. Curtis and I were talking about maybe doing dental, right? Advertising to try to just generate leads because everybody's getting inundated with Medicare. Your T65s, Medicare. Why not send them something that's just dental related? Because once you get in the house, it's all about the relationship, right? But get in the house, form the relationship. Don't try to just do it over the phone. Events. Again, back to activity. So Healthy Living Expo, they have added even more events than they had this year. Okay. Now, I'm going to be sending this out shortly. We have already prepaid for the season. In Palm Beach County, the events are going to be done with Prominence. Okay. The reason we went that route is because this year it was a little silly that I had an ABI agent at a table and then Prominence had one of my ABI agents at another table. Okay. I think it's better that we're just representing one. So we will be there with ABI tablecloth, but your first priority, we'll say, is Prominence. Okay. And for that exchange, Prominence paid for the event, so you guys will not have to pay the 50-50 for the event because Prominence did. Okay. For Broward County, a lot of these are accounted for already, but I will be sending out an email to let you guys know which events have not been taken yet. Basically, if you had an event last year, you get priority on the event. Okay. Physician marketing. I still feel like some of you are not completely grasping the opportunity when it comes to working with doctors. I don't know if you just get easily discouraged. Maybe you had one or two medical centers that it just didn't pan out for you. But the opportunity, guys, is real. I want to say 30% of ABI's total production comes from working with physician offices. That's huge, guys. But yet I got a bunch of yous that are not doing it, and it just baffles me. And again, if you're hitting your goals and you're writing the amount of business you want to be writing, I'm not saying you need to be in a medical center, but I know a lot of you are not doing the amount of business you want to be doing. So I'm confused why you guys are not working with the doctors. So I put ChenMed Dedicated and Cano Healthy Partners at the top. And the reason I put the two of them at the top is because they have an organized system to work with brokers. So some of you are newer. They have membership growth consultants, right? And then the other one calls it something different, but they're all basically the same thing. Basically, they have hired employees that get paid to put patients in those offices. Okay. Those are not agents though. They're just marketers. So they need to work with an agent, because if the person is not on the insurance that the doctor's office takes, then that gives you an opportunity to enroll them. But it has to be a give and take, guys. That also means when you're on an appointment in Delray or in the area of wherever the medical center is, that if you're going to put somebody in one of those centers, that you notify the MGC or whoever you're working with at the office and let them know, because they also get credit for that. So it has to be a two-way street. But several of you that have embraced these relationships are doing very well with these relationships. Curtis, only a year, coming up on his year or just having his year anniversary, has been working with Healthy Partners. It's been a mutually beneficial relationship. Okay. Diana, less than 6 months really with us. Okay. All her contracts came over in January. She started working with Dedicated in Delray. It was just, okay. Then Deerfield opened. I said to her, you need to go to Deerfield. Kelly set her up with an MGC in Deerfield. Now she's working with 2. Every month she gets referrals from Chen or Dedicated. Every month. Okay. Maria Pucci, I told you guys there were 16 sales last month on the log sheet. 70% were from doctors. And she doesn't just have 1 or 2 that we're going to say, oh, she's just lucky because that office feeds her. No, she's working with like 8 offices. She doesn't limit herself. Sometimes we get opportunities where we get medical centers assigned by carriers. Ralph had to recently kind of jump in and take over some of those Prominence offices, because last year when Prominence gave us offices, some of the agents basically dropped the ball. You were assigned an office and for whatever reason, you didn't think it was good and you stopped going in. So now he's trying to establish a rapport with those offices to see if we can figure out where the disconnect was or where is their opportunity. Conviva is another option. I did put an asterisk next to it because many of you know what my feeling is on that, but I know some of you like Conviva very much. My only concern with working with Conviva, and I'm vocal about this, is that they're owned by Humana. Doesn't mean it's a bad thing, but my concern is if you put them on something other than Humana, like WellCare or Care Plus or Aetna, that a Humana captive is going to flip your business to Humana when open enrollment comes. So that's the only thing I would be careful about when you're working with Conviva. Other physician marketing, just through your personal relationships. Y'all have a doctor, y'all have specialists, y'all have dentists. Maybe ask them if they work with a rep. Maybe you can be that person. It doesn't hurt to ask. The worst they're going to say is, oh no, we don't have any interest in that. But ask, right? Can't hurt.
It's funny, your personal relationships. I've been doing this estate sale company for like 12 years.
Uh-huh.
And I've been in insurance now 4 years.
Yeah.
I finally remember what I did.
Yeah.
You know, it's like, it takes a long time.
It takes time. It takes time for it to connect, for them to remember. Guys, you always have to be telling everybody what you do on a regular basis. Even your family. Okay? They forget. They don't really know. They don't really understand.
They certainly don't understand.
Now, when you're working with the physicians, what can and should you be doing? Tabletops, Not all offices are set up for a tabletop, but offer. I know Gabriel several times did a tabletop outside Dr. Burrito's office because there was no room for him to do it in the office. So he just had it set up outside on the sidewalk. But they got a lot of people coming in and out of there, right? It's all about activity. You just need to get in front of more people. Some offices, maybe they have an office for you to sit in where you can actually set office hours. Now, some of you might be thinking, what am I going to do? I'm going to sit in a doctor's office for 3 or 4 hours, but you can get your work done. But the main idea is that's how the staff, I was going to say the girls, because 90% of the people work in a doctor's offices, I feel, are female, but you get to know the girls. You want to know everybody on a first name basis. You want to bring them little snacks or goodies once a week or once in a while. If you don't want to bring it once a week, go to Costco and get the big jars of the pretzels or the nuts or whatever, chocolates, and you put your business card on. You guys had to see what Medicare Missy did. She had like these she made labels that she had made and then put them on the Costco, the big things, the pretzels and stuff with her picture on it. I think it said Absolute Best Insurance, helping you with all your insurance needs, with her phone number. This way, every time the staff goes in and grabs a chocolate or grabs a pretzel, there she is, Medicare Missy, Medicare Missy, Medicare Missy. And then that jar lasts for a month, right? And you continuously go in and refill it. You find out what they like. Maybe they like the pretzels with the peanut butter. They don't want the chocolate, whatever it is. Guys, little things like that go a very long way. But the thing is you have to be persistent. And the number one issue we have with when we assign doctor's offices is you guys are not stopping in every week. And that's the only way you're going to form the relationship. The girl at the front desk changes. And you might feel like you're being a nuisance. Guys, they don't even remember you were there last week. Don't feel like you're being a nuisance. Because everything in life is timing. And sometimes it's just a matter of timing, and that office manager happens to have 15 minutes when you stop by and you haven't gotten to talk to her in 3 months, and now you get 15 minutes with her, and it could open up all kinds of opportunity because now they tell you that they're dropping a contract or they're having trouble with a particular plan. So then that gives you an opportunity to strategize and make a suggestion. Hey, you know what? Certain companies are allowing us to do an SEP right now. Prominence and Humana, if they didn't make a change during open enrollment, we can change their plan using the FEMA SEP. Or a lot of plans, like say they take Bright Health or WellCare, they have chronic condition plans. And your clients or your patients that have diabetes or cardiovascular issues, we can switch them anytime during the year. And the plan might even provide better benefits and value. It's about educating the doctor's offices and the staff, okay? Talk to them about calling their aging ins, meaning aging in, turning 65. Practices that have a big commercial, or maybe they also take ACA, they have that opportunity. Don't you want to keep your patient house? I know you probably prefer certain plans over other plans. If you refer them to me, I'll be able to guide them in that direction. Okay, because just because a doctor takes 5 different plans, they might actually only like working with 2 or 3 of them. They might have some of them that are a nightmare for them. This is what you want to find out, because then you'll guide their patients in another direction for them. I always make it clear you're going to do the right thing by the patient, right? But you also have to be conscientious of where that referral is coming from. If a doctor's office has a good relationship with a carrier, then that's where you kind of want to push the patient. At the end of the day, you're doing the right thing by the patient, because if a doctor's office has a really good relationship with a carrier, that patient ultimately is going to get better access to care. And why are they going to get better access to care? Because that doctor's office knows how to work within that system, or already has a lot of specialist relationships within that carrier, right? Or easily knows how to do the referrals. Mention to the doctors about doing Medicare 101s. If they have a lot of people turning 65, if they have a conference room, or maybe you can set something up at like a diner or something that's down the street where they invite people. If the doctor's office calls up their patients and says, hey, I see you're turning 65. We're sponsoring a Medicare 101. Would you like to come and have lunch or dinner on us? And then you could split the cost with the doctor's office. They're going to get the people there, guys. I promise you. It works. It's effective. I did it for years. Kathy Gardell did it for years. It works. In services, twice a year. I know it's hard, guys, when you're starting out and you know, maybe you don't have the budget, but you got to figure it out because this is a business. I'm a big believer in bringing the doctor's office lunch or breakfast twice a year, whether they have 5 employees or they have 20 employees. But in exchange for that breakfast, they're giving you their time where you have that 30 minutes in front of them and you can talk about why they want to work with you. You know, maybe before AEP, you go over the changes to the plans, what's coming up. The OTC is going up, the OTC is going down. This plan has a better give back. This plan's better for diabetics. They're going to remember everything you tell them, but what you're going to do is you're going to sell them on you and your knowledge and how much you can help the office and help their patients. That's the purpose of doing the in-service. They are not going to remember maybe but 10% of what you tell them. But the idea is that they're going to think of you as the insurance expert and they're going to always want to just send their patients to you with any and every question. Doc, my copay is too high. I can't afford it. I can't afford that medication. I need to take something else. Anytime they get any kind of response like that from a patient, everybody in that office should think of the agent, right? You need to call Claire. Claire can help you with that. Maybe there's another plan that's more cost effective. Maybe you qualify for benefits that you don't know you qualify for. Claire is our insurance expert. Call Claire. Stop in once a week, every week, all year long. Agents have a terrible habit of just starting to go to the doctors right before AEP gets here. What do you think? They're stupid? I haven't seen you in 6 months. Now open enrollment is here and now you're showing up at my door again. Agents kind of do the opposite of what I think you should be doing because they look to go in during AEP. But the reality is if you're right, if you're setting up your year like you should be and you're writing 100 sales or more during AEP, which you all should be, that should be your goal, 100 sales. You probably don't have time to visit the offices once a week during AEP. Unless you're doing office hours or tabletop and actually getting enrollments, you're not going to have that time. But the rest of the time, when you have the downtime, because during AEP, you just want them sending you the referrals. So if the other 10 months of the year, you're working that relationship, I'm sure Ralph doesn't have to step foot in an office during AEP, right? They just know if someone needs something to call Ralph. They just know. Why? Because he trained them to know. Support your team members and their efforts with doctor offices. Can anybody guess what I'm talking about with this? So I was going to send an email and then I decided not to. And we got, we're in front of a good, 30, 35 of you or whatever. We had to meet the doctor, Martha Rodriguez's, last Wednesday. So why do we do those types of events? Claire, why do you think we do those types of events? To engage,
to meet the new doctor, for them
meet the new doctor,
for them to meet us, who they don't know, they have only met once.
Right.
It's all engagement.
What's that? Show the value of working with ABI. Yeah, because here's the thing when we're working with doctors' offices. Maybe for some offices, they just look at it like, oh, yeah, big deal. We're working with Claire. She's sweet. How much business can Claire really give us? Oh, I don't know. But now Claire comes in with her whole team from ABI. And now the doctor's office is going, wow, right? Maybe we need to be sending Claire a little more business because if she has this whole team that's also going to be able to refer to us, we need to take care of Claire. Right? If you're newer and you don't have any physician relationships, it's still a good idea for you to go and meet with different doctors throughout the area, even if it's not your office, meaning you're not directly going to get referrals from them, because it's good to put the name with a face. And then when you're actually sitting in the home, you can say, yeah, you know what? I've been to the office. It's so lovely. It's so clean. They do all these extra services. They do lab. They're open on the weekend. I just met their new doctor. He's fabulous. He's 35. He's from Cuba. He's bilingual. Guys, this business is all relationships, right? Relationships. Now, I got a bunch of you asking me for medical centers, but then a lot of those same people did not show up on Wednesday. So I'm going to tell you that I do take notes. I'm keeping tabs. I'm keeping track. I'm going to be very, very honest with you all as a team. I was insulted by the turnout on Wednesday. I was humiliated by the turnout on Wednesday. And I had some of you go, I didn't think it was that important. I sent out 3 text messages and 2 emails. The email was sent, the initial email was a whole month in advance. It's not going to be often that Stacy's going to say, hey team, I need attendance. I need you all to do this. But when I do, I kind of think ABI does a lot for the agents and how we support you guys. Especially like some of you guys are going to be doing seminars and different things over the next few weeks. And we've invested big in you because I look at you all like we're partners. We're business partners, right? If you succeed, I succeed. If I succeed, I'm going to help you guys succeed. That's what we're trying to do here. We're all just trying to make a living, right? So I'm just going to ask, please, the next time, and I don't do it often. Your time is valuable. I know this. But the next time I put out an email like that saying, hey guys, we have a meet and greet with a doctor's office. They hired a new doctor. They invited ABI to come in. Guys, I need a hell of a lot more attendance than 10 people. They had all this food there. The doctors that make more money than the majority of you guys do, and I'm not trying to insult anybody, but it's true, they blocked out their time to meet with ABI. There were 3 providers in the room, 3. Okay, so I'm not going to say any more on that, but Walmart locations. So it's official. These are the 4. If you want to work Walmart, please send me an email and CC Tara and Ralph. This way we're all in the loop. I need to know in the next 2 weeks who's working Walmart. This is not something that can wait right before AEP where you're like, well, if I got nothing else going on, then I'm going to do it. No, we're already planning AEP now. So we're going to have 3045 Southwest Port St. Lucie Boulevard. It's only 5 minutes from the office. It's right off of Gatlin Boulevard. So it's very close to our office. That's the area we're really trying to establish ourselves in that area. I think those of you that worked St. Lucie last year, like for different things or doing mailers up there, you guys really should consider doing the Walmart. Now, we don't know 100% that we have that location. I'm feeling kind of good about it. What happens is I pay $1,500. It's basically a bid for the store. And then on whatever night at midnight, it all kind of goes into like a lottery. And we'll see what happens. Military Trail. That's the same Walmart in Deerfield we were at last year. Outside Century Village, the bus from Century Village drops them off there. That location was very good for us last year. The agents that worked it last year are going to get the choice for their shift first, and then I will send it out and give other agents the opportunity. Okay. Now remember, we're required to cover Walmart for 20 hours, but that doesn't mean we can't be there 40 hours, guys. Okay. So if you don't have a lot of other activity going on during AEP, then you guys need to be in retail multiple times a week, not just once a week. Even my top producers will usually opt for 1 3-hour shift or 4-hour shift. 10th Avenue, this is a new location for us. This one we definitely have. Humana's giving it to us. Palm Springs, 10th Avenue, just west of 95, the Super Walmart. Okay. So again, that's right down the street here on 10th Avenue. And then we are getting Hypoluxo back again. We've had Hypoluxo for 4 or 5 years, guys. 4? Yeah, I think at least 4. I feel like we've had it for a while. We got it before you were gone. It wasn't great last year. I really believe that had to do with the location of the table. So we're going to make sure we work actively with Direct Health, with Humana, and with the store manager to make sure they place us better. But over the years, it has been a good location for us. So we did want to give it another shot this upcoming year. Now, what are the requirements for Walmart? Whatever shift you choose, you are locked into that shift for the whole AEP. So it's 9 weeks. If you say you're doing 2 days a week, you're doing 2 days a week. If you say you're doing 1 day a week, you're doing one. There's no changing your mind after the fact. The only time you get out of it is in an absolute emergency, okay? Because you're bleeding out and you have to go to the hospital. And then in that case, you need to send a group text message and we'll make sure you know all the agents that are certified to be at that location. Because the thing with Walmart is you can't call in or just call Claire and say, Claire, can you do me a favor? If she's not certified to be in a Walmart, she can't cover your shift. And the shifts are filed with CMS. So it's important that if you say you're going to be there, you're there. United Healthcare last year stopped by the Walmarts often. And I want to say, I think it was Aetna agents told me, we're stopping by the Walmarts to see if the agents were there. You don't want a broker manager from a carrier to stop by the table and nobody be there. There's a little training that you have to do through Direct Health. There's basically a portal because you have to report your day, how many leads you got, if you got any sales. Now, what a lot of you didn't do, and I got to make sure you do this because this comes back to us and whether or not they allow us to have a store the following year, or whether if they're going to open up that store for OEP, whether they're going to offer it to us or not. Sometimes you get a lead, but then you don't sell it to 2 or 3 weeks later. Make sure you're reporting that in the system that you got a sale. Because the more sales we show at Walmart, the better it looks for us, and they'll want us back for the next season.
2 years later.
Yeah. CVS locations with Aetna. Basically, guys, according to Amanda, like as long as they don't already have agents working in there, we can go into any CVS that you want. Again, some of the locations aren't very good. Some of the locations are good. You guys are out on the road, you're in the field. My suggestion is to drive around and scope out to see if there's a location. Kelly's doing like 2.5 hours right now in Boynton Beach, okay? Does she get leads every single shift? No, but has she got some aging in and she's getting some leads from being there that 2.5 hours a week? Absolutely. That's why she's doing it. Okay.
Just Stacy, I have a question.
Yeah.
So we just drive by and we ask the pharmacist or something?
No. After you find by, scout out locations, email me, and I'll check with Amanda on availability. So Amanda is the broker manager for Aetna. As you guys know, CVS owns Aetna. Okay, so they actually want the kiosks. I sent her a picture of like a cool kiosk that United Healthcare has and said, hey, this is what we need in the locations versus the little, they basically just have like a little stand right now. So she is going to work on getting us better kiosks. And even that, guys, like as silly as it sounds, you know, we had those that did CVS last year. We had 5 locations, 5 kiosks. It really was a cheesy like stand. You can make it work though. Like it had Aetna, it said Medicare, you know, you got to, you know, engage people. But they charged me $250 for each of those kiosks. They gave me 2 for free and I had to buy the other 3. Yeah. So.
Well, a couple of years ago, United Healthcare at Walgreens had a nice setup. It was like a tower with a locking door and a fold down table.
Yeah, well, that's kind of what I showed her. So
Yeah.
she's working on it.
Because
This one was like a stand.
Yeah,
And then to the left, it had like just a little table. And then you could have the 2 chairs. I thought that was great because it just looks more inviting, like, hey, come sit down with me, talk to me. Although even if you have a table and chair, if you're working retail, the right way to do it is standing on your feet. Unless you're sitting down with a customer, get off your ass, because nobody is going to come talk to somebody that has their face in a laptop or a phone or is looking down at a book and is just sitting there. You have to be engaging. You have to be welcoming. Yeah, I'm hoping they're going to have better. Okay. Now, up in Port St. Lucie, before I move on, only because I know it was good for Ed last year. He was in the CVS at 9801 US Highway, Port St. Lucie. He got 5 sales out of it. So figure he was there 9 times and he got 5 sales. Now, he wasn't doing a 5-6 hour shift. I think he was doing a 3-hour shift. The nice thing about Aetna, it's not like Walmart where we have to commit to 20 hours. If you just want to go and do a 2-hour shift, as long as they know that that's what it is, that's fine. That's all you have to do. Okay, so depending upon what else you're working on during AEP, it's important to work retail into your schedule, just to get in front of more people. Okay, commission statements. We've had so many questions the past month. So, and I'm sure some of you had the same questions, so that's why I just want to go over it. So just as a reminder, Agency Block is where you look up your statements. I know half of you don't even look at them, but agencyblock.com, your username is your email address. If you don't know your password, just say forgot password. Regardless if you were ever in there before or you have and just haven't been in recently, just do forgot password and you'll be able to reset it, okay? It's important that you're looking at your other statements, and the ACA commissions is always paid on the 1st of the month. But what's been happening, especially with Cigna, they pay you multiple months at a time. No rhyme or reason, guys. It's not like it's like, oh, I could say, oh, they're going to pay you January, February, March, and then you're going to pay. Nope. Sometimes you'll have clients on there that they're paying you for 3 or 4 months, and you'll have other ones that you're not getting paid at all, or you're getting paid for 1 month. Basically, what happens is if the money comes into ABI, you're getting it on the 1st. Whatever comes in this month, you're getting it on the 1st. That's just how we do it, okay? We don't have access, though, to your book of business. And Health Sherpa is not your book of business. That's just your enrollment platform. So when you're not sure, you need to go to Cigna's website and look up your book of business. You need to go to Ambetter's website and look up your book of business. If the person is active and if their premium is paid, and not all the systems will show you if they paid the premium, some of them do, and you notice 2 or 3 months went by and you didn't get paid, that's when you do an audit, not beforehand. Audit, ask Tara for the spreadsheet. She'll make sure Judith has it as well. But you're going to email your inquiry to commissions@absolutebestins.com. You're not emailing Tara. Tara don't know anything about commissions. Tara doesn't do commissions. She doesn't know what you're supposed to get paid. Okay? We have a commissions department that does that. So please, just again, make sure you're going to the right people for the right things. Now, the other thing that's happening, and poor Beth, I think Beth is on the call, it happened to her. If you don't have at least 5 lives on Cigna, they're not paying commissions. So the first time you write a policy, second time you write a policy, until you get to 5 people enrolled with Cigna ACA, they're not going to start paying you. Once you get to the 5 lives, then they'll start paying you on everybody. I know Claire's shaking her head. I know it's not right, but you know what? We have no control. We have no control. The other reminder, and I know I said it on previous calls, but not everybody's on every call, is I went blank. Oscar, Bright Health, and Molina are not paying on SCPs right now. So if you put somebody on the books for May 1st, June 1st, there's no commissions. Again, still write the business. Get the contact, get the client, make them a client, sell them a dental plan. That's how you'll make some money now. You'll get the renewals next year. okay? But they're not paying any immediate commissions. So who can you write right now and get paid commissions?
150% of.
Ambetter, Aetna, United Healthcare, and Cigna, right? Yeah.
If they qualify.
Right.
Yeah.
Okay. Now, if you get paid commissions by a carrier, meaning they don't come by ABI, they come from the carrier directly. And everybody here has a different setup, okay? Don't email us for your commissions, because if I'm not paying them to you, I can't look anything up for you. You got to go to the carrier to find out what's up with your commission, okay? Agent support. Okay, the other thing I briefly want to overview is election codes. Okay, I'm bringing this up because half my Friday was related to this, and a lot of days my questions are related to this. The day I was driving to Tampa for Easter weekend, Friday afternoon, I had a couple of different calls, and it was all related to election codes. I think you guys overthink it, to be honest with you. You also need to just take the time to read the app and read each one. Some of them, guys, I mean, you can eliminate immediately, right? You're like, no, that's not it. That's not it. Read through the list of options. But if somebody, this one comes up over and over and over again. If somebody is working past age 65, okay? Whether they had A and B all along, okay, or they're just applying for B now, and A, regardless, you're using SCP lost employer coverage all of the time. Ralph, is there any exception? I don't think so. 100% of the time, if they're coming off a group past 65, always lost employer. Doesn't matter what the A and B dates are. They're losing employer coverage. That's the special enrollment period, guys. Now, if somebody is turning 65 and their A and B dates are the same, and they're coming off employer coverage, what are we using? IEP, new to Medicare. I got people saying, but they're coming off a group. I should use. No, not when they're new. When their A and B dates are the same, they're new to Medicare, regardless. Whether they're 55 and on disability, whether they're 65, if the A and B dates are the same, they're new to Medicare. Okay? Sometimes the A and B dates will be off by a month or two because they didn't enroll in time. In that case, it will still be new to Medicare as long as you're within the right window, okay? But if they're coming off a group, then you're going to do, and the A and B dates are different, then you're going to do SCP coming off employer coverage. Now, this is the other one you guys get confused on. If the Part B enrollment is delayed, meaning it's after the A date. It's two different dates. But the person did not have employer coverage. The person was on a not standalone, ACA, or an individual coverage, or had no coverage. You can't use, well, you can, so it depends upon the company. So I don't want to confuse you. If it's prior to the be effective date, you can say new to Medicare. It's technically their ICEP, not their IEP, but depending upon the enrollment form, it doesn't always distinguish it. So you can use new to Medicare. However, if Part A is January and Part B is May, and now we're already in the month of May and that person didn't choose a plan, you cannot use new to Medicare after that Part B effective date. What do you need?
5-star.
A special enrollment. You need a special enrollment. So whether it's 5-star, whether it's chronic condition, whether they're dual eligible. Right now we have the disaster for FEMA only Humana and Prominence are accepting it. So you could use SCP, FEMA.
Tell them to move.
Claire says, tell them to move. Yeah, if they move out of their planned service area.
Well, I learned something last week with, it was a referral. She was it was actually her 65th birthday.
Mm-hmm.
And Tara taught me about the OEP new.
I'll go over that one too, because, and we have gone over it before, but you just forgot.
Yeah.
Okay.
Fabulous.
Yeah. So OEP new, guys, that can be used if, say, somebody chose a Medicare Advantage plan and their Medicare date was April 1st. And now you get referred to them and you're within 90 days of that effective date for their Medicare Part A and B. If they are not happy with the Advantage plan they chose, they have a second election period called OEP new. So you basically, if they were effective April 1st, you have the month of April, the month of May, and the month of June to use OEP new and put them on a different Medicare Advantage plan. Okay.
That's what I was asking you about the other day. I just didn't know what it was called. Remember I said, I think there's 90 days.
Yeah, but that was a little different. What you have to be careful with is it's 90 days from the effective date of the A and B. So if somebody goes on the plan, say 3 months after their A and B effective dates, they don't have another 3 months. You have to be careful of that. Okay, just a reminder on the dual eligible, because this came up a couple of times too. And I feel like this one's an easy one, but there's still some confusion. If somebody is dual eligible, you never have to worry about late enrollment penalties. Those people don't have to ever worry about a donut hole, okay? They can enroll anytime once per quarter, the first 3 quarters. So whether they're original Medicare with no other coverage, whether they're Medicare Advantage, if they're dual eligible, you can sign them up. It's effective the first of the next month. It's an SCP. And on the app, depending upon the app, it'll either say MDE, Medicaid dual eligible, or it'll say, my state helps me pay my Part B premiums. Okay, just look for that in the list of things. It's there, I promise. Okay, I think these are the main ones. I didn't put the FEMA one on here, but I mentioned it. Did someone have a question on the call?
Stacy. Hello?
Yeah, can you speak up?
Yeah, it's Missy. Can you hear me okay?
Yes, I can.
All right. Sorry, I have a confusing one since we're on the subject. So this man owns Lester's Diner, you know, the Lester's Diner there. He 71 years old. He wants a med sup, but they didn't get he just got Part A starting May 1st, and he won't get the Part B until July 1st, the GEP.
Okay.
How do I do is it guaranteed? Because he wants a Medicare supplement, and I don't know what.
Absolutely, Miss. The guaranteed issue for Med Sup has to do with the Part B effective. It doesn't matter what the Part A is.
Okay.
So as long as it's within 6 months of the Part B, he's guaranteed issue on the Med Sup. Now, the Part A was effective when?
May 1st.
Okay, you want to do the PDP, sooner, because remember they could get Part D if they have A or B. They don't need both. So do the Part D now, and you can also do the Med Sup now. The Med Sup just won't be effective till July 1st, and his Part D will be effective June 1st.
Okay, his doctor wants him to do United Healthcare, not United American.
Okay.
But I can do that 6 months before with you at United Health too.
Well, you're within the 3 months now, so it doesn't matter anyway.
Oh, true. Okay. Okay. So he had
I'm
no
not
coverage
sure
before.
United Healthcare stance on, I'm not sure on United Health. We did confirm that like Cigna will let you do the 6 months in advance. Aetna does, UA does. I don't know the answer to United Health, but you're within 3 months anyway, so it don't matter.
Okay. I was concerned because he didn't have any other coverage. So it's still go on Medicare guaranteed issue. All right. Thank you.
Yep, that doesn't matter. It's the be effective date. You're welcome.
Thank you.
Okay, the other thing I want to bring out is this second to last one. This keeps coming out and there's a little confusion. So I think on a previous training last month, the month before, I had mentioned that if somebody moves out of their plan service area, they can get guaranteed issue on a med sup. That is absolutely correct. But what some of you heard was if they move out of the plan service area. So several of you thought if, say, somebody was up in New York on a med sup and moved to Florida, and now the med sup is more expensive, so they want a different sup, that you could get them the sup on guaranteed issue. Absolutely not. It's when they move out of their plans, mostly it's related to Medicare Advantage service area, they get guaranteed issue. Once in a blue moon, and I know it happened to Ed, and I think it happened to Danny or Claire, I don't remember. There are very few, but in certain states, and I can't even remember what Ed's situation was, like South Dakota, it was a weird one. And then somebody else, I think it was Massachusetts, where they have like a state med sup plan that if they move out of that state, that plan will terminate. It's a very rare thing. 90% of your Medicare supplements or 95% of the med supplements sold nationwide are portable. So if somebody moves from one state to another state, they can take it with them. Now, if they get a rate increase, that does not qualify them for guaranteed issue. If they're healthy, they can you'll have to submit an application and they're going to do full medical underwriting, right? Med sup to med sup. So don't discount it. They might be able to get through underwriting. And if you're not sure, so you submit the enrollment and you just tell the client, don't cancel your old med sup until the new one gets approved. Okay, but the guaranteed issue, they have to be moving out of the planned service area. Okay, yeah.
So I have one tomorrow.
Okay.
And he is Medicare Advantage, moving out of
Planned service area because he's going from one county to another, right? Yep. So he'll get guaranteed issue.
For guaranteed issue.
Yes.
That has nothing to do with the effective date of Part B. It's,
Correct, because he moves out of his planned service area.
so that's a whole nother selling point for me that I did not know.
Mm-hmm. That's why we need to come to training.
I'm here.
I know you are.
Not county to county doesn't always, county to county works on an HMO.
Well, that's what I'm saying, planned service area. So I'm trying to remember, somebody had something recently, I forget. And so, you know, the way some, I think maybe WellCare, and I'm not sure, actually has like multiple counties, has the same Advantage plan. So if it's the same, and Aetna does, if it's the same plan ID number, they're not moving out of the planned service area. Yeah, well, PPOs always, yeah, because they're regional. So sometimes they're 3 counties, sometimes they're 5 counties. So if somebody's on a Humana PPO 068 and moves from Dade to Palm Beach, well, that's still the planned service area. They don't get guaranteed issue.
Yeah, but the United Healthcare, the 018,
Mm-hmm.
Palm Beach County to PNS,
Treasure Coast,
or PNS
correct,
County,
is
that-
different because Treasure Coast has a different PPO. So they've moved out of the planned service area. Okay. All right, Medicare Edge. I just kind of want to run through real quick. Some of you are very versed in this. Some people are still confused by what they can and can't do. So what is the purpose of our Medicare Edge platform? For us to shop for Medicare Advantage and Part D drug plans. Guys, all the carriers are on there. Even if you can't do the enrollment because that carrier hasn't approved it, or if you're not appointed with the plan, you can still look up the information. You just have to click at the top where it says add non-licensed plans, okay? You have the ability to enter the client's demographics and save it for the future. It kind of acts like a CRM. For those of you that are not eligible for ours or you don't have your own, it's a place to store all your clients' data, right? So whether or not you're enrolling them today or today, just information gathering, and you're going to enroll them in 2 or 3 months, might as well get all the information in the system and saved. Then you don't have to do it later. You're going to send the scope of appointment via text or email. Now, I have brought it up on the Connecture calls that, hey, why can't we do a face-to-face signature too for a scope? Because when we are face-to-face, I just end up texting them and showing them on their phone how to do it. But I know a lot of you were just using paper when you were face-to-face because there wasn't a way to do it. It's kind of silly they don't offer the option. Hopefully on the new update for next AEP, they will.
Their phone system wasn't taking it properly. I had that problem, so I did a lot of paper.
What do you mean the phone system?
Their phone wasn't transmitting.
Oh, you weren't getting the transmission on the phone. Got it. RX, I think that's the best thing about it, saving their medications, because especially when you get that phone call like 3 months from now and they're like, oh, I went to the pharmacy and I had to pay and last year I only paid this, then you can look. Sometimes I get that call and guess what? It's a drug that they didn't tell me they were on. And I'll say, I don't have that on the list. You didn't tell me about that drug, right? You keep everything in the system. It helps to protect you. Or, yeah, do you remember, Mrs. Jones? I told you probably in July or August, you were going to go into what's called the donut hole or the coverage gap. Well, you hit that limit. Now you're paying 25%. We had that discussion when I signed you up. But it's nice to have the data in Medicare Edge because then you can see it. The pharmacy is important. You want to put the pharmacy in because depending upon the plan, pharmacy costs can change a little bit. Looking up the RX costs, the tiers, the coverage gap. A lot of you are using it for physicians. I think it's getting more accurate, but I'm still going to have that disclosure on the physician lookup because the handful of times I checked it out, I found some inaccuracies. Unfortunately, unless you go directly to the carrier portal, that is the only way that it's 100%. And even then, I'm going to say 99.5% because we know carrier portals sometimes don't have accurate information either. But guys, especially you're new, do not call a doctor's office. You can call. I'm not telling you not to call, but do not enroll somebody on a plan based upon what a doctor's office tells you. After you call the doctor's office and they tell you what plans they're on, you need to go to that carrier site and confirm, because that will come back as a founded Section 8 allegation. If you tell Humana, oh, but I called the doctor's office, or you tell United Healthcare, I called the doctor's office, because in all of their trainings, they say that the most accurate way is the portal. Okay, so you can't go by that. Medicare Edge gives you the ability to enroll in person, enroll via text, email, and I should say, do your HRA. Now, some of them you're doing the HRA right on the platform. Some of them you got to go into the link to do the HRA. But other than United Healthcare, we can pretty much do everybody's HRA. That's also available on Edge. Compliance. Okay. Guys, this is becoming a big problem. I think COVID happened and all of our brains got a little fuzzy, or there's that line that we are never supposed to cross, but it got a little gray and fuzzy during COVID, and more of you were crossing that line. And I know because I have the conversations. Now, some of you, it's innocent because you're calling me with this question going, hey, I'm sitting here with the client and now it wants me to send it for signature, but I'm with them. I just want them to sign right here. When you pick the plan, when you're looking at the list of carriers and you click on add to cart, this is going to be the next screen, regardless of what carrier you're enrolling. How will you completing this form? If you are doing the enrollment over the phone, guys, 100% of the time, you should be selecting send to beneficiary to sign and submit. This is the compliant way to do business. And I know some of yous are not doing it. And you know what'll happen? It'll catch up with you. You are only to select complete and submit form myself when you are face to face with the client. Because it's them that is submitting the form themselves. You're either going to have them type in their name. They're either going to select a box that says submit, because I know carrier to carrier, it's going to be a little different when you get to the end. But if you are over the phone, you are sending to beneficiary. And then what will happen is after you complete the application, Connecture is going to give you the choice to either text it or email it. If you are doing your enrollments over the phone and you are clicking complete and submit form myself, you are committing fraud. And a bunch of yous are doing it. I need you to stop doing it, please. Please. Because it will catch up. Things have happened to agents where they get a complaint and then it prompts a carrier to do research. And now they're checking your IP address on that enrollment, seeing you submitted it at 1 a.m. from your bedroom. They know your client wasn't with you at 1 a.m., guys, at your house. Okay? I know once in a blue moon, things come up. You go sit down with the client, you do your face-to-face meeting, you have them sign the scope, it's late at night, you can't verify the Medicare number, something happens with the PCP, you can't find it, or they're not sure, okay? So now you have all the information, you're all ready to go, but you're missing one thing, so you can't submit it. You need to do it the right way. If you're not going to go back to the house, you need to send to the beneficiary to sign and submit. Okay? Okay. Any questions about that? Silence.
Everybody's freaking out right now.
Sorry. I thought it was clear. Apparently it's not. Apparently it's not.
Stacy, I have a question about Edge. I typed it in the chat,
Yes.
but is there a way
Oh, wait.
that we can pull up all of our clients, or do you just have to type in the individual name?
No, you can. You can. There's a way. I'll send you an email on the instructions. I'll send it out to the whole team.
Okay, thank you.
Yeah, when I did the Edge training, I showed you guys. So I'll send an email. Okay, that's the other thing too, guys. When you go back in, if you didn't know it in Edge, you can access the PDFs for your scopes of appointment. You can access the PDFs for your enrollments. Those should be saved, I think, somewhere else as about, whether it's a file on a cloud or on your computer, not paper. You don't need to freaking print them and put them in a file. Don't do that. That kind of defeats the whole purpose of everything. Those of you using a CRM, we upload it into Agency Block. Every scope of appointment, every application gets loaded into Agency Block. Now, it's not automatic. We have to download it and then upload it. The only thing that's going into Agency Block automatically is the enrollment information. So the data gets transmitted. So Agency Block communicates with Medicare Edge, sends over the client's name, address, date of birth, MBI. I think it's even sending is it sending the physician, Tara? I think we can request that though. We have to talk to Tanya. Tasha, right? Tasha at Agency Block. Because I think, oh, but they're using Sunfire. I know somebody told me they're doing it. No, they're using Connecture too. Well, regardless. Okay. ABI, any other questions on Medicare Edge? And then I'm just going to touch on the quoting engine. Anybody on the call? I'm going to check the chat. Is ABI quoting app sorted out? That's on my list. It was the first thing. Did you see that, Tanya? Okay. So no, CSG is the company that runs and operates this platform. I don't know what the issue is, but no, our app is not up and running. They said IT is working on it. They've been working on it for weeks. I figured out we're not the priority because what they did is they stopped charging me and they refunded me what they already charged me for the app, and they're not going to start charging me for the app until it's up and running. So I don't know why, but you could go to the portal on an iPad. You can go to the portal on a phone. You could go on your desktop computer, your laptop. Everybody's link is the same, guys. But when you go to the link, if it does not look like this, the ABI, the red, white, and blue, then you are on the wrong portal. Because again, other FMOs lease the CSG software as well. Because we're getting responses from you guys, well, my username and password isn't working. And then when Tara does a screen share or you bring it up on your computer, we're not seeing ABI. We're seeing just CSG, or maybe we're seeing Agent Pipeline or Integrity, or maybe at one time in your life you were with Gordon Marketing. That's why it's not working, because you're not at the right link. Now, if you have it saved as a favorite, maybe you need to delete it. Maybe you need to put the new one in. Maybe you need to, what do they call that? Clear your cookies and delete your history and do all that, because sometimes it keeps taking you to the wrong one. But if it's this typed out, do you notice it says Insurance Tools Portal /ABI? That's us. Okay. Your email address is your username. Just do forgot password if you don't know your password. Everybody has access, maybe with the exception of Ethan because he's just the newest, but everybody else should have access, right, Tara? Everybody else should be good. Yeah. Okay. Quote. So what are we using it for? This is where you're going to quote your med sups. This is where you're going to compare the Medicare Advantage with the alongside hospital indemnity. They call it filling in the gaps. So when you're trying to sell the hospital indemnity and you're showing the client, hey, your MA is $200 a day for the hospital, and look over here, this plan will cover the $200 a day for the hospital. Does that side by side to help you sell hospital indemnity. That's the other time you're going to use this portal. Final expense quoting. Now, I think for now, for ease, you guys really should just stick with Aetna final expense. If you really want Mutual of Omaha final expense, we have it. But other than those two guys, we're not going to contract with 20 different final expense. Those are mostly always come up in the top 3 or so. Usually with final expense carriers, it's just a couple of $1 difference. Okay. You want to sell, but you want it easy. We don't want it complicated. Okay. I'm not using the quoting tool, even though it's there. I'm not using it for dental because it's just listing plans, and I don't know. I find it a little confusing. I'm not saying you can't, but these are the main reasons why we have it, what you're seeing up here on the screen. Same goes, what's the other thing that it quotes on there? Even with the hospital indemnity, I'm kind of like, let's just stick to the carriers, because we're not price shop hospital indemnity plan. So if you're selling a Cigna Med Sup, well, that's kind of a bad example because you probably wouldn't do a hospital indemnity with a Sup. But Cigna has the indemnity. Heartland, for me, I think that's the easiest one. So if I'm selling Medicare Advantage, for me, I would just do the Heartland all day. Okay. But if you're selling maybe somebody under 65, or you plan on bundling other products, like dental, like cancer, then use either Aetna or Cigna's supplemental platform, because then you can bundle a bunch of products on one platform with one premium. Make your life easy.